Hi folks, today I'm talking to you about summaries, how to end a session, and a little bit about how to assess someone in a first session. So on to summaries first of all. So a lot of you have been asking me how you finish a session rather than just saying, all right, that's it. How do you properly and professionally finish a session? And using a summary is usually a really good strategy. So today I'm just introducing you to the idea of a summary, and there's a great chapter on that in Geldard and Geldard. So the summary is a skill that's quite similar to paraphrasing. Some of you have said that you've noticed that you went to do a paraphrase and ended up doing a summary. So the main difference between doing a summary and a paraphrase is the summary talks about the main points over a conversation. So whereas a paraphrase is reflecting back something that someone has just said, so content that they've just shared. Whereas a summary can draw on content they've shared throughout the session, and you're drawing together those main points. So often it can be like an overview of what they've said to you. And so one of the main points of doing a summary is it lets the person know that you've been listening and understanding what they've been saying. So other times when to use a summary, besides just wanting to show that you're listening and following, the beginning of a new session. So say if you've already met with someone once before and you want to start again in a new session, and you want to kind of recap what you might have discussed in the last session. So it gives you you and the client a jumping off point for the new session. So you kind of can say, so last week we talked about this and this and this, and you were thinking about maybe this. So that's a great way of kind of recapping, and the client will generally then go forward with that and update you on anything that's changed or they're thinking about it since they last saw you. And it gives them that invitation to decide where to go with that. During a session that's going nowhere. So if you find that you're going round and round in circles, or the client's kind of talking about the same kinds of things, then, a summary can be really useful because it gives the client a picture of what they're talking about, helps clarify the problem, and helps give a new perspective. If you're putting it into your own words, it gives them a new perspective. And you can use a summary to remind a client of their strengths. So you can summarize on, the things that the client has coped well with or done well from the stories that they've shared with you. And so as you're working with someone and you're aware that your time is nearly up, it can be useful to, once you notice that, it's getting closer to the time that you need to finish up, about 10 minutes before, to point out to the client that the session needs to finish soon, so we need to wrap up soon. And at that point, it's a great idea to provide a summary of what you've covered so far. It also gives the client a chance to talk about something they may have been trying to get to, but they haven't got there yet. So it might give them a chance to just add one more bit of information that they wanted to share with you before the time's up. And often clients are not keeping an eye on the time. They don't have a sense of how long it's been because they're really, engaged in emotionally and cognitively what they're talking about. it's unrealistic to expect that they would know how much time has passed. So it's a good idea if you're meeting with someone in this kind of counselling context to have some kind of time mechanism. So maybe a clock next to the person, so you're not having to look at the clock to check the time. So you can kind of do it more subtly, or even a watch can be useful. But make sure you don't abruptly finish the session. So make sure you indicate when we're getting closer to time that we need to finish up. So you give the person a chance to give that information they want to give, and to psychologically be ready for closing that session. Towards the end of a session, you might want to talk about meeting the person again, and that can be useful because it leaves the door open for the person to talk about the issue again, and it gives them a sense of they're doing something about the problem. So it can be a good idea to discuss that at the end of the first session, to talk about when you might meet and how often you might meet. But we want to make sure that we're not creating a dependency at the same time. So we don't want people to be coming in just for the sake of it, only when it's useful. And if it's not helping or if it's not useful, then we need to look at other alternatives for referral. So, in summary, as you're getting closer to the end of the session, let the person know that you're in control of the length of the session, because it's too much to ask for them to be aware of the time that they've been in the session. So warn them when the session's coming to an end. Let them know that we need to wrap up soon. Is there anything else that you feel like you haven't covered that you want to mention today? Talk to them about contract for future appointments. So do you think it would be helpful if we saw each other perhaps once a week for a few weeks, just to see how you're going? And finish each session with a summary. Outline any goals that the person has made and try and get some positive feedback. And that's similar to what Elizabeth Kent was talking about. She tries to start a session on a positive and ends on a positive, and that can be a really great thing. So reminding someone of a strength, for example, that they have shown or that they've identified themselves, is a great way to end a session. So that's, in a nutshell, summaries and endings. In your practice sessions, we want you to try and use some summaries as you go along. So sometimes you might want to use one halfway through a session to see that you're on the right track, and certainly towards the end of a session you want to be doing that before you finish the session. So see how you go with that today in your practice sessions. Now I'm going to move on to assessment and the first session. So the first session is a chance to establish the relationship with the client, but it's also a chance to understand the nature of the problem, whether we can help them or whether we need to refer them to someone else who has expertise in that area, whether there's any risk to that person as well. And it gives you a chance to discuss what the client wants to get out of their time talking with you. So it's quite an important session. It sets the parameters of how you're going to work with the person. It gives you information about the problem and the severity of the problem, and how you're going to go forward with that. So one of the first things we usually do is, once someone's seated, we, ask them, did you find the place okay? Or, a little bit of small talk is fine. Offer them some water. Making sure that they're comfortable is really important. So, obviously, a noisy room or a room where people are constantly walking through is not ideal. And I know in the school environment, it's not always possible to have a soundproof area, but just keep in mind, somewhere with privacy is best. So when we're talking about consent and confidentiality, I'll go into that in more detail on our lecture on ethical issues. But the first session is usually the time that we lay out to the client the confidentiality that can be expected between the two of you. And sometimes that varies across settings. So the confidentiality for example, a counsellor or a psychologist would be different to that which is expected of a teacher. There's also limits to confidentiality when we are worried about someone's safety or their well-being in terms of abuse and so on. So we want to just briefly touch on confidentiality and the limits to that in the first session. And I'll give you the way to do that in the ethical issues lecture. So we also want to talk about how the service works, or what you can offer the person, so they know kind of what's coming. So maybe you want to talk about we've got half an hour to discuss how you're going, or we have this time every week to meet and discuss this issue, and then we'll follow up every 2 weeks. So giving them an idea of how long you can see them, how often you can see them, and that kind of thing. Gather pertinent information. So that's one of the key goals of the first session, is to understand the problem so you can best address it, and understand what the client wants to get out of the first session or out of their working with you. So it's really important that we don't assume what the client wants to get out of talking to you. So it might be that they have, for example, when you're talking about adults, they have a drinking problem. However, that's not actually what they want to work on with you. They want to work on issues in their relationship. So we need to really help the client explicitly talk about what they want to get out of their time talking with you, and not make assumptions based on what we feel would be a problem. So some of the information that we would collect in an initial assessment in general would be demographic information. So finding out how old the person is, their relationship status, emergency contact details, what they do for a job, or what they're studying at uni, or what year they're in at school, and who they live with. Then what they're presenting with. So what brings them to talk to you. So usually a way to do that would be to say, so what brings you to talk to me today, or what led you to make this appointment, or that kind of thing. And how much is this bothering you at the moment? How long has the problem been there? So, when did this start? How long's it been going on? How often does it happen? Family background. So whether they've got children, whether they've got siblings, whether maybe they've got a step family situation, or who lives with them, that kind of thing. Physiological functioning. So that's things like sleep, diet, and exercise, and that can be a really good indicator when someone's not coping so well. So the things that we look out for are changes in those. So, for example, someone who normally doesn't is up early in the morning and doesn't need all that much sleep is suddenly sleeping and finding it really hard to get up in the morning. Or vice versa. Someone who needs a lot of sleep is now not sleeping much at all. Diet. So if someone who normally eats a lot starts to eat very little, that's a cause for concern, and the other way around as well. Exercise. So someone, for example, who is really into soccer decides to drop their team commitments and stops engaging in soccer and practice and that kind of thing, that would be a cause for concern. So any kind of withdrawal from an activity that they love is a sign that not all is well. Again, if someone is generally on the lower end of their activity scale and starts to over-exercise, sometimes that can be an indication that something's going on too. Personal history. So has there been any medical challenges lately? Have there been any health scares? Educational history. Have they finished schooling? Are they studying at the moment? How did they go in that time when they were at school or at university? Have they attended counselling before and how that went? So sometimes people unfortunately have not great experiences when they have sought help before. So maybe they've been met with judgment or just advice giving and that kind of thing. And that's kind of given them a poor view on whether they can be helped or not. And it's important to know those kind of things so we can say, yeah, I can understand how that could have been difficult. And so perhaps we can just work together to make sure this is working for you. Risk assessment. So we won't be covering risk assessment today. We'll cover that in week 8. But that's the chance that we have to assess whether someone's at risk and whether we need to make a referral or take action to make sure that they stay safe. And the client's goals for counselling. So I've touched on that before. So it's important to remember that not all emotions and experiences that we have are would be classified as a mental disorder. It's normal to feel anxious or sad or angry or whatever the feeling might be. And, we would have experienced these feelings maybe coming up to an exam, you might have felt anxious, or following a breakup, you might have felt sad. Leading up to a job interview, you might have felt worried and stressed, a health scare or losing a pet. So these are all life experiences that that bring on emotional responses, and they're all very normal responses. So we need to remember that not every experience of anxiety or sadness and so on is necessarily a problem. Sometimes the person just needs to talk it through and go through it before it improves for them. There's no exact definition between normal and pathological. So one way to help conceptualize it is that when symptoms become quite severe and persistent is when it is a problem. So if the symptoms, say someone's sadness, starts to interfere with their ability to get to work or to go to school or to have functional relationships, then that's a problem, and that's something that needs to be addressed with a referral to the appropriate professional. Changes in sleep and diet as well, as I've talked about too. And if there's personal distress for the client, so if the problem is really worrying them or causing them distress, then that is a reason for a referral as well. So this is just a definition of mental disorder. Involves changes in emotion, thinking or behaviour, or a combination of these, and they're associated with distress and problems functioning in social, work or family activities. And some can be mild and only interfere in a limited way. So maybe there's one particular fear you have of dogs that interferes in certain areas, but in general you're coping really well with life. Whereas other mental health conditions are so severe that at times people need to be in hospital. You know, for example, for someone with very severe depression, or someone with schizophrenia who, you know, who cannot distinguish between reality and a hallucination, for example. So the broad categories of mental disorder are psychotic disorders. So that would be things like schizophrenia, where you might hear voices or see things or smell things, and you can't distinguish what's real and what's not. Then there's the mood disorders. So that would include depression, bipolar, and things like postnatal depression and so on. Anxiety disorders, so that would be, you know, social anxiety and so on, PTSD. And so the most common disorders that you would come across would be the mood disorders, so depression usually, and anxiety disorders as well. So generalized anxiety or social anxiety, so shyness or someone who tends to worry a lot. Those are the kinds of general disorders that are more common in the school environment. And then personality disorders as well. So in the Kotler and Kotler book, it has a great kind of overview of the different disorders that you might come across, and what are the signs and symptoms of each one. Not so you are expected to treat these disorders, but so you can help recognize them and take the appropriate steps. So in the mental health assessment in our first session, that's when we're looking at what's going on for the client through talking with them and observing their body language and their responses to our questions, asking them about signs and symptoms. So they talk about, for example, anxiety. We ask them, you know, how does it show up for you? What do you experience when you're feeling that way? So we can get a sense of what kind of symptoms are going on for them. And establishing the therapeutic alliance. So we're giving the person a sense that we care about them, we're understanding what they're telling us, and we're going to work with them on finding the best approach to feel better. So the mental health assessment is will give you an indication of whether the person needs to be referred. So it'll give you a sense of, is this a blip? Is this a normal response to a difficult problem? Or is this a problem that has been going on for some time and it's interfering with the person's daily life, interfering with their ability to work or to study or to be part of their family or to sleep or to eat and those kinds of things. So in general, the format of an intake interview depends on where you do it. So for example, in a counselling agency, you might use a very lengthy form to cover lots of different areas of questions around, for example, whether a person uses substances, you know, their sleeping and eating habits, their functioning in daily life, their social relationships, all that kind of thing. However, the critical part of doing an assessment is to make the client feel comfortable. And so not peppering them with questions, trying to weave in our questions amongst paraphrasing and empathy and that kind of thing. So making it more of so making the session flow and weaving in the questions along there. So we really don't want it to become a question and answer session, because that first of all takes the power away from the client to tell their story, but it also doesn't really help you develop that therapeutic relationship. Open questions are the best way to elicit information, and they're the best way to avoid making assumptions about the person. And empathy and attending skills are crucial. So when we ask someone about you know, their behaviour or their habits or you know, their struggles, then it's really important that we attend to that well and we show empathy and a non-judgmental stance. Now, you wouldn't use these formal assessments necessarily in a teaching context, but these are some of the assessments that we would use to assess, for example, symptoms and what's going on for a person, to assess risk, and so on. So you can have a look at these. There is all available through the Black Dog Institute. Okay, so now have a look at the video that that has been uploaded to Blackboard, which gives you an example of an intake session. And it's quite a detailed intake session. The counsellor asks lots of questions and gets lots of information about the client's symptoms and her life at the moment and her history and so on. But what I would really like you to pay attention to is how he does this. So he doesn't ask question after question after question. He weaves his questions in to the overall conversation. So notice how he does this. Notice how he responds to the answers to the questions. And in our practice sessions, we're going to be doing a similar thing. So we're going to be gathering some information from your client and doing this in a way that helps build rapport. And we're also going to be adding in some summaries too. So there's going to be a lot to concentrate on. But have a look at the video now and see what you think.